Hi, and welcome to this podcast for the University of Alabama at Birmingham's Research Center of Excellence in Arsenicals. My name is Mina Nabavi, and I'm a program manager at the UAB School of Public Health. Today, we are joined by Dr. Seyed Hasnain. Dr. Hasnain is an active scientist, administrator, institution builder, and policymaker. He joined the National Institute of Immunology in New Delhi after postdoctoral training in the United States and Canada. He is known for his contributions to infection biology and functional molecular epidemiology of Mycobacterium tuberculosis, the TB bacterium, and designing novel intervention strategies. With over 300 publications in peer-reviewed journals of high impact and over 36 patents, he has mentored over 150 PhD, MD, and postdoc students, many of whom have received prestigious medals, awards, and coveted recognitions. He is a national science chair at IIT-Delhi, and he leads an active research group at Sharda University in India. So thank you so much for being here today and joining me on the podcast.
It's a pleasure to be here.
So today we're going to be talking about a topic that we haven't covered as much on this podcast, COVID-19, which shouldn't be a shocker to anyone who's listening, and specifically India's response to COVID-19. So to get us started, for those of us who are not familiar with what happened during India during the height of the COVID-19 pandemic, can you briefly describe the situation from 2020 to 2022? And I know that's a big ask to do in just a few minutes, but if you could enlighten us.
Thank you so much for inviting me to this podcast.
Yes.
It's a pleasure to be here. I have been here. This is my second or third visit to University of Alabama, Birmingham. Thank you once again. COVID-19 is something which has created and will remain a new landmark in our history forever, for a number of different reasons. In India particularly, you have asked a very pertinent question, what has been the major milestones from 2020 to 2022. I think in January 2020 was when the virus was first detected and entered. And initially people were wondering, maybe yes, maybe not. And then finally, the March to early June 2020, there was nationwide lockdown. And that, I'll comment a bit on that a little later, but that was one of the major milestones that was done. And I think it was a good decision to declare a nationwide lockdown. And then, of course, the first wave, July to December 2020, and which peaked in mid-September 2020. The second wave was in March to July 2021, and that was a Delta wave. And that was one of the most I would say, disturbing time for COVID in terms of India. The third wave was the Omicron wave, which was January 2022, mostly the B2 variant. As you know, this virus is one of the most highly evolving virus. I am not aware of any other virus other than the HIV virus, which undergoes so quick mutations. This fellow mutates like crazy. It just keeps on mutating depending on where it finds its weakness. And mutates. And where it finds it's giving an advantage, in the process it does also a lot of other mutations which may not be, as scientists, we may not be able to find out what it is giving to the virus, but it is mutating, some of which are giving advantage to, and I'll talk about it also. The fourth wave was the Omicron sublineages, and today we are dealing with Omicron variants, sublineages. These are again standard names given: alpha, beta, gamma, delta, Omicron, just to make sure that the original is one and you have different progenies of the virus.
Right.
So the lockdown was there, but lockdown was absolutely, they had the second wave, the Delta wave that I called, had devastating effects. We saw the maximum number of deaths. In fact, before the Delta virus infection came in, we had almost thought that we have conquered COVID. And we quite reduced the pressure on mass gathering, on mask wearing and social events, distancing, etc. We thought COVID is over. India has its own genetic combination, it has its own herbal medicines and its own younger population. All this is true. But there was a lull. And as I said, there's a lull before a storm. And the storm came, the Delta wave. Huge number of deaths. overwhelmed hospitals, no beds for anybody. People were dying on the ambulances, on the roads, queues at the crematoria. There were not enough space to burn the bodies or to bury the bodies, and oxygen shortages, ventilator shortages. This was something that shook up the government completely. And I must here add, the decision taken by the government of India, including our Prime Minister, Mr. Modi, was primarily responsible for taking stock of the situation and saying, hey, enough is enough. We need to control. And what we saw subsequently was a reflection of his firmness and dedication that we need to take control now. We have done enough. One of the things that he did was, India has many science-related departments. We have the Department of the Medical Research, we have Department of Science and Technology, Department of Biotechnology, the CSIR, the Council of Scientific and Industrial Research. And all of them departments wanted to get a piece of the pie that I'll do the COVID work, we'll do. And Mr. Modi said nothing doing. Just the Indian Council of Medical Research will be singularly responsible for doing it. And the then Director General of the ICMR, who is a cardiologist and a good friend, he decided that he will now take full control because he was directly reporting to the Prime Minister of India. And that is where the change started happening. And that is where things started moving for the better.
Well, that leads in really nicely to my next question. So you mentioned that when, COVID was first discovered, India went into a lockdown, right, for 3 or 4 months, right? And you mentioned that it wasn't too bad, or wasn't as bad as we were seeing across other countries in the world. Can you talk a little bit more about those types of mitigation efforts that India implemented? So you mentioned lockdown. What about masking? What about closing borders? What sorts of things did the Prime Minister implement?
See, a lot of things happened during that time. And in fact, I remember my wife was given the charge of running the COVID diagnostics. Mm-hmm. That was ICMR, Indian Council of Medical Research Laboratory at the Safdarjung Hospital. India is one of the finest hospitals, and she was heading the Institute of Pathology. And she was working. She was asked to select a team and work under high COVID times, completely, with no other place was empowered to do except she was given the task to train as many people. And that was a snowballing effect after that. It spread all over the country now, detection centers, diagnostic centers, from a single place to all of the country. That was the vision of the Prime Minister of India, to make sure that we take full control. So the lockdown did have an effect. In fact, lockdown did not prevent, but it delayed the wave, enabling better preparation for the next. And that was, I think, a strategic decision that the government of India took. And it really helped. Of course, it had its own economic and political consequences, social consequences, right. But health consequences. There were also forced masking. You have to wear mask, social distancing. And these things, and of course, the slowdown of the economy and everything, it had an effect, but it did have a big effect on the way the COVID was controlled. There's no doubt at all in my mind that this was absolutely. Also, what we find was that there was many other cases where, all COVID, we made full use of India's IT prowess. India is in information technology, global leader. Right. And I must say, we conquered at least the bad parts. We made sure that bad part of the COVID, the Delta wave, is behind us, and we don't have a repeat of Delta wave. And that is because of extensive use of information technology. Now, that was a time when apps were available, and everybody, even if you don't have a smartphone, the apps were made such that even the ordinary phones can also take that apps. And then it reports to you who you are. Surveillance was a major effort that was made. Surveillance to find out where the virus is spreading. To alert you, hey, you have just met somebody who had a virus, so stay away, get yourself tested. Test reports will come immediately. Then they'll say, okay, have you taken a vaccine? Go and take a vaccine. We are giving you and a message will come. Your vaccine appointment has been fixed in this place near to you. So this was all done through the surveillance system, through the app system. Mm-hmm. And that, I think, the many apps were there which were really making a big. At the same time, India decided to go in full time into vaccine research. One of the things which Mr. Modi did was he really meant when he said Atmanirbhar Bharat. What it means, Atma means self, Nirbhar means dependent, Bharat is India. I want to depend on myself. The world will not come to my rescue. I will have to do it. And this was one of the things that really the philosophy of how we conquered the bad times of COVID. I will have to do it. We will have to do it ourselves.
We can't rely on others.
We can't rely on others.
Yeah. So my next question is around vaccinations, which you briefly touched on. How has India's COVID-19 vaccination program been implemented? And I know you mentioned there were apps going out to tell people you can get vaccines here or it's time for your next vaccine. What COVID vaccines are available in India?
In fact, I must say, India is perhaps the only country that has several firsts to its credit. We have today 7 vaccines.
Wow.
Which are being approved. And all these are emergency healthcare vaccines to begin with. Mm-hmm. All the COVID vaccines were declared as emergency healthcare. Of course, subsequently it became available to everybody. It doesn't have to be an emergency vaccine. So we have 7 vaccines. One is, of course, the Covishield, which is AstraZeneca. AstraZeneca is a UK company, Oxford collaboration. And they manufactured this vaccine in the vaccine production facility near Mumbai, Pune. The Serum Institute of India. The Serum Institute of India is the world's largest vaccine manufacturing plant anywhere in the world. Nowhere else you have so many vaccine production. So they gave a contract to Serum Institute. You make this vaccine for us. And that was used for selling the serum vaccine elsewhere. In parallel, the government of India, Mr. Modi personally went to the other vaccine manufacturer, including the Bharat Biotech in Hyderabad, BBIL. They have been working independently. Serum Institute simply got the technology from AstraZeneca and started making it. Bharat said, I'll do my own research. And that is where it was supported by the Indian Council of Medical Research and the Bharat Biotech together joined hands and developed an indigenous vaccine. They call it Covaxin. Covaxin is nothing but a heat inactivated virus or chemical inactivated virus, which means a total virus.
Right.
You kill it, except that its structure, protein, etc. is remaining. So the body will still think that you have a live infection, and then but there's no live virus.
Right.
It'll respond to it immunologically, and that was named as Covaxin. And today in India, the Covaxin made in India is also sold elsewhere. Today we have 7 different vaccines. Of course, the Covishield, which was the one made in partnership with the AstraZeneca, and we have the Covaxin, 100% Indian. We also have Sputnik, which is a Soviet vaccine, which is also something similar to the existing products, but that was also made in India. But the world's first DNA vaccine, nowhere else in the world, was made in India, and that was made by Zydus Cadila, a pharma company based in Ahmedabad, Gujarat, Mr. Modi's state. That was the first. So you don't need to get a protein, you get a DNA into your body. Then the next one was, the 5th one was a protein subunit vaccine, which is the BioE, which is again based on technology given elsewhere and made in India. And mRNA vaccines, Genova, also same technology available. And again, Bharat Biotech came up with the first new vaccine. Normally, vaccines are given by giving a shot.
Right.
But Bharat Biotech decided to give it a nasal spray. So just give us into your nose and then you are vaccinated. And that was also the world's first nasal spray-based vaccine against COVID. So in reality, India makes 7 different kinds of vaccines, of which 2 are completely brand new. Nowhere else in the world it's being made.
Right?
Novel. India, world's first. The DNA vaccine, the nasal vaccine. So we have 7 vaccines. This was all preparedness, and also again a reflection of the determination of the Prime Minister that we must do that. Without that, it's not possible.
Right.
We should not. One of the things that he did was, which is a very interesting observation that he had, and which was reflected also, and that is to say that let us not don't let the perfect be the enemy of the good. Why should we wait for the best thing to happen, then only we'll vaccinate? The best coronavirus vaccine is the one you can get as soon as possible. Let's not worry about making a perfect vaccine. And I think India's success is to a large extent based on this notion. Don't let the perfect be the enemy of the good. For us, it's important to handle the coronavirus, handle the COVID disease. If this vaccine is working, go ahead and do it.
Right.
We'll perfect it later on. That was it.
That's great. So a follow-up to that, and I don't know if you know the exact figures off the top of your head, but what is India's vaccination rate, or what percentage of the population have been vaccinated? Given that there are 7 different vaccines, people can choose, depending on what was available at the time. What is...
So most of the vaccinations are done in India because early time, these 7 vaccines that I talked about, 2 of them were predominantly. One is the AstraZeneca vaccine, the one with Serum Institute. That has been the major share of vaccines in the market in India. And what Mr. Modi did also was initially it was people had to pay. Outside the country, it was $25 to $40 per shot. We were charging $4. Then they said, no, we will not charge you. We'll give you free, completely free. So today, much of the vaccination is by virtue of the free vaccine given.
Right.
Both, I would think, market share, majority share is AstraZeneca's, the
right.
Serum Institute, Covishield, and the remaining is Covaxin. Others have come up, but because of COVID is going downhill now, it's not so much of a problem. But today, more than 1 billion doses have been administered. More than 1 billion doses.
Wow.
In fact, 98% of our population, which are vulnerable, 98%, and we are a 1.4 billion people, of which majority is, of course, younger people. Younger people were not vulnerable. But 98% of the population has been already given the first dose. And 91%, in fact, now the numbers are much more, have been given both the doses. And it's close to 100% have been given now both the doses. And many are now being given the repeat dose, the boosters. So that's a record.
So it doesn't sound like vaccine hesitancy is as much of an issue in India as it has been in the United States.
And in other places. I was in Germany for a meeting organized by the German National Academy of Sciences. This question was asked, how did India not see any vaccine hesitancy? In Germany, people are not willing to get themselves even tested, leave aside vaccinated. And parts of the US, the same thing. I think the problem was the Delta wave. The Delta wave that came led to so many deaths. People were scared. They were really very scared. Oh my God, I can die. And if I die, I can't even get a good burial. I can't even get a good funeral. So if everybody is saying, and because of the internet and because of the IT revolution, everybody was getting message, go and get you tested. Go and get this. You are having sneezing, having fever, loss of taste. Go and get tested. And then the reports are monitored centrally. So I think that fear that I may die forced people to get themselves tested, to get themselves vaccinated. And that is the reason why we have a much higher compliance than any other country in the world.
So what are the lessons that other countries should learn from the COVID-19 Indian experience?
I think the lessons for the other country to learn from the Indian experience, I think is quite a few, I would suggest. And one of them, which is the most important one, is that you have to be self-reliant. You cannot depend on some other country to do it. Although India was very generous in the initial phases, when the vaccines came up, much of it was actually given out to free to other countries also. India didn't get, because we thought we don't. But then later on it came out that, okay, we need it first. So I think the important part is you must rely completely on surveillance and spread and timely alert. And so that's where I think the surveillance system was beautifully organized by the apps and by others. We had a COVID apps, and COVID apps will immediately alert you. Your neighbor has
tested positive. Right.
Stay away from him. And here is the nearest place. We have booked a place for you, and it's free testing. And then if you're positive, alert will come to you. Within a matter of few hours, you are tested positive. We have booked an appointment for you to go and get vaccination. I think this is utilization of the IT is a major game changer. And I think countries should be willing to adopt this technology in their plan also.
Mm-hmm.
And of course, reliance on experts to tackle regular COVID surges. You should make sure that research and others go hand in hand. There are a lot of questions about Indian vaccines being made. Have they been tested? Have they been proven to be scientifically? As I said, don't wait for the best thing to happen. Save lives. That's more important. Later on. And we proved it. Whatever vaccines, Covaxin and all that, all these have been published in the best of the best journal. New England Journal of Medicine. Science, Nature, they all carried reports about how these Indian vaccines have worked. So, but that need not come first. First should be saving lives. So the priority should be very clearly defined, and that's a very important message. Quite often we say first we must be, I think the fact is COVID has been a game changer.
Right.
The way we developed vaccine, the way we handled the problem, it never happened before.
Mm-hmm.
It also showed a very important thing, which is also moral for many countries. In India, we have a Sanskrit word that says Vasudev Kutumbakam, which means the world is a family. And COVID showed that the world is a family. Doesn't matter which religion you come from, doesn't matter which region you come from, doesn't matter which political system you come from, you can also come down with COVID anywhere in the world. So you need to handle looking at that we are all human beings. So that was a very important major lesson.
COVID doesn't discriminate. It doesn't matter if you have money or you don't,
doesn't.
what the color of your skin.
Nothing.
And none of that matters.
Nothing.
So how prepared is India, and I guess we can broaden this question, and the world as the pandemic continues into 2023 and new variants arise?
India has been, I must say, quite well prepared, and that's reflected by the fact that we had these new variants which have come up, and we did not. Of course, we see more of in terms of cases of infection, cases of positivity, but we are not seeing the kind of deaths or fatalities or mortalities that we saw in the first phase.
Right.
Two reasons: A, we were also prepared. B, we were infected earlier, so our human body saw the foreign particle and started working against it. And C, we also took the shots. So I think that is where it has been helping. So despite the virus evolving very fast, I think we have been able to tell them, look, guy, we know who you are. We are also prepared. I think that is what has helped today.
Yeah.
But we should remember, the new variants which are coming up, they are evolving. And some of our own work has shown that they are evolving such to go spread out without giving infection, without giving any mortality, but infect you and causing you a degree of illness, morbidity we call it. So there may not be mortality, but a degree of illness. And so I think the bottom line is this virus is going to be here for long, like the flu virus.
Right.
All of us above the age of 60 are advised to take a flu shots every year. I think perhaps a time will come, or maybe it has come already, that we should be taking shots or boosters to make sure that we have enough immune activity in our system.
I know our time is wrapping up soon, so I just wanted to ask you if there's anything else that you would like to share with our listeners before we close.
Yes, it's a wonderful. Thank you so much for inviting. Don't get scared about COVID. COVID is here to stay, but take precautions. And I think follow the national policies and rules, whatever. Don't. So, the people who have been behind it, they are very well-read people, knowledgeable people, and they advise you. They advise you based on some grounds and some merit in this. So I think follow what the government tells you to do. And if you have still some questions, there's a book that we wrote, Decoding the Pandemic. It's available on Amazon. I repeat again, Decoding the Pandemic. We have authored it. And this book tells you about everything, including you may have questions about where did this virus come from? Which country it came from, or what it is, I will not like to say beyond that. Read for yourself and find out.
Well, and what we can do is we can put a link to the book in the description of this podcast, so anyone who's listening can directly find the link to the
Absolutely.
book.
Thank you so much.
Well, thank you so much for being here today and joining me during your short visit in Birmingham. It's been great learning more about India's response to the COVID-19 pandemic, all that has been done around vaccinations, and lessons learned from this pandemic.
Thank you so much. Sorry we may have taken a little longer time, but it was...
That's okay. This has been a great discussion.
Thank you. Thank you so much.
And thank you for listening. Please tune in next time for another episode from the UAB Research Center of Excellence in Arsenicals.